Hello, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the 6th episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. On March 13th, 2020, Orange County, North Carolina activated the Emergency Operations Center in order to respond to the COVID-19 pandemic. Today, we will reflect back on this somber anniversary as well as get an update from Orange County Health Director Quintana Stewart. Quintana, welcome.
Hi.
If you would, please give us a COVID-19 update for Orange County, North Carolina.
Sure. So as of Monday, March 15th, Orange County has a total of 7,852 lab-confirmed cases of COVID-19. Over the past 7 days, we've seen 14 new cases. I'm very pleased to report this number, as this is a very low number, one of the lowest we've seen since the beginning of this pandemic. With that case count, we are averaging about 2 new cases each day. Unfortunately, we've also had a total of 97 deaths related to COVID, and this is about 10 additional deaths since we recorded the public health chat a month ago. As I stated moments ago, our case count has decreased. It's really low. Our ED visits for COVID-like illness is also low and pretty stable, and our percent positive is 0.6%. As of testing data through March 10th, we've conducted a total of 262,689 COVID tests. It is important that we continue to test. Although our cases are low, it's important that we continue to test for COVID if we've been exposed to a positive case and if we have COVID signs and symptoms. We are all working very hard right now in our community to get folks vaccinated as quickly as we can. As of Monday, March 15th, about 19.1% of the Orange County population has been fully vaccinated, meaning they've received their first and second doses. We are also very pleased that just a couple of weeks ago, a third vaccine became available. The Janssen or Johnson & Johnson vaccine is now also available for our use in the community. So about 19.1%, that is roughly 28,427 people. So we still got a ways to go, but this is great progress. Orange County Health Department has administered a total of 6,285 first doses, and we've given 4,208 second doses. We have a host of vaccine providers throughout the county working hard to get those who want to be vaccinated. We are currently vaccinating priority groups 1 through 3. So group 1 included our healthcare workers, long-term care facility staff and residents. Group 2, our older adults, those 65 and older. Group 3, all of our frontline essential workers. And so as the governor recently announced, we look to open up and begin vaccinating part of Group 4 tomorrow, Wednesday, March 17th. This group includes adults at higher risk for exposure and increased risk for severe illness. So it's hard to believe that we are a year into this COVID-19 response. But it is also exciting to know that the vaccine is here, one very strong tool in our toolkit to help us get through this pandemic quicker.
Thank you for that update. Now let's turn to the year anniversary of responding to the COVID-19 pandemic. In reflecting on the past year, I am struck both by how stressful it has been and also how remarkable. It is a time that we will never forget, and I think we can both agree that public health has risen through the challenge. Quintana, I've spent the last week talking to staff and partners about their reflections on this past year. I would like to ask you the same questions that I've asked them. During the pandemic, what have you lost and what have you gained?
So I think one thing that I've lost, sleep. And seriously, I've lost a lot of sleep, but it was worth it, and it's always a pleasure to rise each day to serve our community. The other thing I would say that I've lost, and I've really noticed and felt the loss, is the ability to do some of the in-person family gatherings, is our ability to celebrate some milestones in a traditional way, and also our ability for closure to say goodbye to some loved ones. I lost a dear friend during this past year, and it was hard to not be able to go to a traditional service and have that final viewing and say goodbye. So those are some of the things that we lost, and that I personally felt the impact of COVID-19 in a great way. um, I guess for some of the things that I have gained, um, I have gained oh my gosh, a host of tools for connecting with family and friends, in a different way, whether it was virtually or just outdoors, like in a large parking lot or in a park. And but those were unique and great things. And I think these are all things that I will continue to practice and do even once the pandemic is over and many of these restrictions have been lifted. So I gained a lot of respect for teachers. I always respected my son's teachers, but having to do some of this virtual schooling at home, my respect for educators has grown tremendously.
Yeah, that's a great answer. And I completely agree about the teachers. Yeah, I have to say for me, what I've lost, I would agree, lots of sleep, and just missing certain family milestones and just being able to hug family and friends and see them in person. But thank goodness for Zoom and all the
Yes.
other things you mentioned. What I've gained has been just being grateful to be alive, being grateful to be employed. I'm will never take that for granted, and I won't take celebrations with family for granted. And I definitely never took our teachers for granted, but I really won't now.
Exactly.
In public health, they are also the heroes, and I'm
Yes.
thankful. So now we will take a look at what staff had to say, as well as note some milestones and achievements throughout the year.
I've lost family members, friends, and relationships.
I've lost a few connections with friends and family due to differences in understanding of the pandemic. I lost a lot of freedoms because I am someone who is high risk. So it's very close to my heart, all of this response.
For some of the contract interpreters that we had, some of them lost the parents. Meanwhile, they are serving the county. So it was like kind of, be conscious of how they are also trying to keep going and always serve the county. Meanwhile, they are having the pain for relatives.
I think the thing I've lost the most in the last year is sleep and like time, because this year has felt like a decade and I miss all of you very much.
Obviously, professionally, I miss seeing our kids and our families and our programs. I hate going into our building and it's dark and empty. I mean, we're using all the space, we're doing virtual programs, we've got supplies everywhere. It's chaos as we're trying to get stuff in and out, but I miss seeing the people and kids running around in the gym and all of that. And I'm really hoping to get that back soon. We're starting to do some in-person program in small groups and optimistic that will continue to get better.
I think one of my biggest losses this year is celebrations with my family and the family navigators. We have lost 3 of them to other jobs or moving since the pandemic. So I'm down to 6 navigators. One graduated school and got a job at Duke. The other moved to Tennessee after getting married. Another one got a great job opportunity with the Chapel Cooperative City Schools with transit department. So not being able to celebrate those great accomplishments, and that's been a big loss for me.
What I lost is that connection with people, seeing people, hanging out with them, and most of all, seeing my family who's across the seas.
I feel like that's the one thing that's been such a big loss, both for them, their peers, all kids in our community. I mean, it's just really tough to lose a whole year of school. And, most of them are resilient, and the schools are, and the community is, but it still definitely seems like a pretty big loss.
I lost a dear friend. I'm sorry.
And what I have gained is an immeasurable respect for public health in ways that I never knew was possible. And a lot of respect for every single person on this call, because I've seen how hard everybody works. And when I'm having a bad day, I remember that there are a lot of people that are working a lot harder than I think I'm working. And so I have a lot of respect for all of you.
I also gained a lot of pride in what we're doing and in the environmental health staff, because I keep asking them to do something else and to do something else, and they're just saying yes, and they're doing a great job. And leadership among that staff is really emerging.
Gained somebody else's 15 pounds for sure. But also too, just the gain is seeing the strength within our different communities and how they've pulled together to respond, asking great questions, working to help each other, just the coming together of some of the communities that we're serving is a gain, because we are creating relationships.
I have gained an immense knowledge of pandemic response. I never knew about emergency preparedness. I have made a ton new friends, learned so many new skills about coordination and leadership and understanding project management. It's just been incredible.
I've gained more family time and more family communication with my husband and my two children. I have an 18-year-old daughter and a 12-year-old son.
Oh, I just think fantastic camaraderie amongst so many more entities that we knew each other, we might have worked with each other in some capacity, but that capacity was certainly limited. And what the pandemic has definitely done, I guess in a positive light, is really made people rely upon each other, reach out, break silos, and for that, I'm appreciative.
And I feel like through this now mostly online communication with folks that I've just gained a tremendous amount of opportunity to be in communication with folks that, I probably wouldn't be face to face. And in some really, really awesome spaces that have popped up because of, a need for more mental healing and just connection through this pandemic. And so I just count myself super lucky to have those opportunities and to be in spaces with some really awesome people.
Gains, my life has a slower pace now, which has not, I miss people tremendously. It's not been all bad to slow down. And my siblings and I have gotten much more systematic about our weekly, well, we never had a weekly Zoom call, but my father died during COVID, and the pain of that and the isolation of the pandemic got us pretty committed to a Sunday call. And that's been especially great because I have a brother in Switzerland who obviously can't come here for anything. So having that weekly is really sort of centered and stabilized my life in a way I didn't really know I was missing before, but I'm so glad I have it now.
But it feels good that I'm able to do a job that communicates something positive during all this, because that's just been really helpful for me, because we're doing something good instead of just trying to sell another widget. But yeah, it makes me feel good that I like to take information and try to visually get the point across, or at least, make it simple for people to understand. So yeah, it was kind of nice seeing that my work was being used for something good. So
I want to point out that this is National Women's Month, and I'm the only man on this phone call. So we have clearly a lot of talented women in Orange County. And so I would lift up a cup to y'all if I had one, but y'all are doing a great job. And in fact, just as I'm writing, Renee Price, our chairman, does a twice monthly column, and she's pointing out all of the elected women in Orange County. Every governing board in Orange County is led by a woman. Every governing board in Orange County has a majority of women, except for Hillsborough, which is 50-50. They have 3 of each, 3 men and 3 women. 2 of our 3 state legislators are women. So Orange County really is led by women. And, we've done a great job in our response. So I think that is something that everybody can be proud of. But
something I gained was a pandemic puppy. My family is a cat family, so this was really crazy. But I am out walking more, which is so nice to be back doing that and to have to do it because it was easy to just stay at my desk all day.
Gained a lot. I've gained a lot of friends within the health department and mentors, and have learned so much within the past year, and have a lot of respect, not only for the people here in this meeting, but for so many others who have taught me a lot about what public health is, and just, all of us being human and being like, hey, like talking about stuff in meetings and just trying to catch up and texting each other to see how we're doing, phone calls. I feel like that's what I've gained this year. So no, I don't feel like there's any losses, only gains. And I'm so happy to be a part of this group and working with you guys so we can beat this virus.
On the last episode of Public Health Chat, we talked to Environmental Health Director Victoria Hudson about the contest to recognize local businesses that have been vigilant in ensuring that their staff and customers feel safe, secure, and well served during the COVID-19 pandemic. Each winner will receive a trophy and $1,000 in advertising support in the form of advertising on Chapel Hill Transit buses. Quintana, would you be so kind as to announce the winners?
Sure. The contest was split into 3 categories. The first place winner for the best business who took great care to keep their customers safe from COVID-19 is Mina's Hair Salon. Second place in that category went to Weaver Street Markets. The first place winner for the best business who have done an excellent job of keeping their employees safe from COVID-19 is Present Day on Main. Second place goes to Technica Editorial Services. Finally, I would like to announce the MVP. The overall best business who took on the daunting challenge of a global pandemic and knocked it out of the park is Franklin Street Yoga. One of the contest entries said it best. Lori has thoughtfully provided online and outdoor options for those who prefer to keep up their practice that way. In-person classes are conducted with every caution in place to ensure the safety of participants, such as very limited attendance, spacing, filters, and open doors. She has been a true source of support for mind and body.
Thank you, and congratulations to the businesses. I want to thank you, Quintana, for all of your hard work during this pandemic, for your leadership, and for participating in this public health chat today. Stay safe and healthy, everyone. Goodbye.
Bye.